Hey everyone! So I've been doing my practicum at Partnership Health Center, and they started in 1989 in the basement of the county health department. And they lasted there for just a couple years. I guess they were almost there for 10 years, but they got federally qualified in just a couple years after that. And then they moved to Alder Street, the building over there, and then they gained a pharmacy and also the dental clinic, which is a big hit among their patients. About 10 years later, they started renovating the Creamery building because they just expanded so much. My supervisor was actually employee number 50 or 51, and now they have over 600 employees. So they've just blown up in the past 5 to 6 years. But anyway, so they moved to the Creamery building in 2009. They still have offices over at the Alder Street building, though, so they're kind of a big deal. So I've been doing most of my time in the Paparello Center Clinic, and that has been going on for about 12 years. It started when they were at the old Paparello building, and the clinic consisted of one exam room with a desk outside of it where the social worker sat. And now that they have this new clinic, they have 2 exam rooms, and we have a little area between the door and the whole Paparello Center, so we kind of have our own separate area. We're not out in the middle of everything and all the chaos anymore, so that's cool. So our population served, just the partnership in general, they serve the medically underserved population, and that just is people who don't have health insurance, or they just have really crappy health insurance, so they need a way to pay for the remainder. And so we actually have the sliding fee scale, which is, a cool little thing where, say you have a $50 appointment and now it's $10. So a lot more affordable for people than, nothing at all. I read a cool quote on their website, and it talked about how in the Missoula area, it's not a lack of providers that's the problem, because there's tons of providers in Missoula, but the lack of insurance to cover those providers. So over at the PAV, our population is generally homeless individuals or people who are at risk of being homeless. So it's pretty neat. You can actually be seen at the Pavarello site even if you're neither of those. We don't deal with any money or billing things at the site. It's all through the main site. So if you were there, you'd still get billed. You just wouldn't be from us. And eventually, in the near future, I will be working more with the Ryan White program, and the population that program serves is HIV positive patients. But I don't know too much about that at this current time. So some community factors for that affect our clients. On the positive side, the Pavarello Center is a really cool resource that is super helpful to us, obviously for housing us, but also just for the health well-being of patients. For example, say someone comes in and they have an injury or they're really sick, and you're not going to get any better by sleeping out, under the bridge. You're going to get better in a clean environment with, warm water, clean water, and a place downstairs that can help with your follow-ups and help you get better. So it's really cool for that. There's a couple other resources that really help out our clients. We get a lot of individuals at the PAV, and they really need glasses. They have really bad eyesight, but they can't afford glasses. Glasses are really expensive, and glasses isn't something that one of our programs, Healthcare for the Homeless, HCH we call it, and that just covers basic medical expenses. And it's federally funded, so it doesn't, but anyway, it doesn't cover eye care by any means. So we work with the Lions Club, and they can hook people up with free glasses, which is awesome. We also have a few different agencies or programs, funding, I'm not quite sure. Different local churches donate money help donate money. They kind of, a few bucks here and there, which makes a huge difference. For dental, for a lot of our clients. A lot of studies show that dental hygiene is, totally correlated with physical health. And I mean, probably, I don't, yeah, physical health. Sorry. So, the HCH doesn't cover dental, but we have a bunch of things where we can, get money for people to get their teeth cleaned. Or a lot of people have like rotten teeth that have been in there forever and they have this crazy mouth pain. And so they just need their tooth pulled and cleaned, and we get the funds together. And with the sliding fee scale, like I said, it totally the lowest amount they can possibly pay, that's what they pay, which is really cool, which is still a lot for, some people, but really cool. I'm running out of time, so I'm just going to jump into something I've noticed that really harms our clients in sense of medical care is Medicare itself. It covers things that it deems medically necessary, which isn't a whole lot. So a lot of things like labs and things aren't covered. And so luckily we have these extra programs to kind of help our homeless population be able to afford those. And it doesn't cover a lot of medication. And so, the sliding fee scale makes it super low. But still, even $5 for someone who doesn't have a job, doesn't have a place to live, is still a lot of money. So we do what we can with the programs we have. And I'm really sorry I went over on time. And I look forward to hearing your guys's.